We're going to discuss the rights of medication administration. Now, the rights have evolved over the years, and for the longest time, there was only 5 rights of medication administration, and that's changed in the last couple of years. You're going to see, if you go any Google searching, those kinds of things, there'll be some institutions and textbooks that talk about the 6 rights, the 7 rights, the 8 rights, the 9 rights. I've tried to bring them all together, and we're going to discuss the 10 rights of medication administration. These rights are checks that are put in place that need to be looked at each and every time medication assistance is given or medication is administered. They are performed prior to every medication administration. They're really put in place. The checks are there to eliminate the potential for medication errors. They're designed to make us be aware and up and in tune with the act that we're doing to make sure that that medication administration can be performed in the safest possible manner. Medication errors, it can be more than just a little bit of an upset stomach or a little bit of sleepiness. Medication errors can have life-threatening results. We can have people who can die by receiving the wrong medications, the wrong dose of a medication, by receiving medications in combination with other medications. So it's imperative that we stop and walk through these 10 checks before we get that medication into the body. Using the 10 R's will help you deliver assistance with medication administration in, again, our safest possible manner. The 10 R's are the right medication, the right person, the right dose or amount of medication, the right route, the right time, the right day, the right reason, the right expiry date, the right documentation, and the right to education. We'll look at each of these individually. Right medication really refers to, did we grab the right drug? Do we have the right medication to assist this person in taking? So in order to know that, we have to identify that drug. We can read the label on the drug container carefully. We can check that label against the client's care plan and their MAR. Now, a MAR is a medication administration record. It's a listing of the medications that the person is on. We always want to read that label twice. We want to read it when we're removing it from the shelf or the container, and we want to read that label, reread the label, double check it when we are preparing that dose or assisting that person in getting the medication out of its packaging. The second right is the right person. Are we giving this medication to the person that it was prescribed to? So again, we can check the prescription label. The client's name will be on that prescription label. We want to check the label for both the client's first and last names. Ask the client to state their first and last name and possibly their date of birth. We could have 2 Mary Smiths who were both born in 1935, maybe one in May though and one in June. So we want to make sure that we have the right person for this medication. We can identify clients according to our facility policy as well. Facilities and agencies often have identifying policies. We can ask a supervisor if they could confirm the client if we're not sure or we're not familiar with that person. We might be able to check the client's ID band if they wear them, and oftentimes we have a client photo in their Cardex or on the med card or attached to their MAR. So you have to be 100% certain that you are giving this medication to the right Mary Smith. Our third right is the right dose. We need to make sure that the dose we are giving is the dose that was prescribed. Now, dose is our medical term for amount. So the amount of medication that the person needs to take will be on the prescription label. It will also be listed, or should be listed in their care plan, and it will definitely be on the medication administration record or the MAR. The correct amount of medication must be taken. If medication is in liquid form and they're ingesting it orally in liquid form, you could find that the measurements for that will come in a variety of different ways. It might be in imperial measurements, so it might be in ounces. It might be in household measurements, so it might be in teaspoons or tablespoons, or it could be prescribed in metric units like milliliters or cc's, cubic centimeters. Important to remember that milliliters and cc's are equivalent, so there are 30 milliliters and 30 cc's in 1 ounce. There is 5 milliliters or 5 cc's to 1 teaspoon. There are 15 milliliters or cc's to 1 tablespoon. So that just helps to give you a double check of that dose or that amount. Important that we ensure that we're using our proper measuring device. So if it's prescribed in ounces, we want to make sure that we have a medication cup that actually has ounces on it. If it's in milliliters, we want to make sure that we have a measuring unit that's going to be able to allow us to accurately measure those milliliters. We want to ensure that the right amount of medication is getting into that person. The right route. How a medication gets into a body will affect how quickly that medication works on the body and what areas of the body it is working on. So the route, how the medication gets into the body, will be on the prescription label again. It should be in your care plan and it will be listed on your MAR. If it is an oral medication, that means that it is getting into the body by the mouth. It might be swallowed. It could be chewed, it could be swished. Somehow the medication is entering in through the mouth though, and that's how it's getting into the body. If it is a sublingual medication, it's going into the mouth, but it's not swallowed or chewed. It just sits under the tongue and dissolves. In fact, clients are counseled not to chew or swallow. Topical medications are applied to the skin or the mucous membrane, so they are put on the surface of the body and they're allowed to absorb through those. And those would be things like creams or ointments or transdermal discs or patches. Inhalants are breathed in. That is their route of administration. They're breathed in, so they go in through the respiratory system. They can be breathed in either through the mouth or the nose. And parenteral medications are injected by a needle. So that would include our subcutaneous injections, IM injections, or IV injections. It's important that you understand the route and that the medication is being given via the right route. Medications may act in a toxic way if given in a different route, or they may be ineffective if the route that was prescribed is not followed. Our fifth right is the right time. In order to work properly, medication has to be taken at the correct time. Number of times a day is usually prescribed on the label, so it'll say, take 1 tablet twice a day. The care plan and the MAR will oftentimes indicate to us exact times or hours where that medication is to be administered. Now, according to your facility policy, you do have a little bit of a window of time on either side of that ideal time with which to get that medication into the person. Some facilities state that you can be 30 minutes before or 30 minutes after the time frame. Other facilities state it's an hour before or an hour after. So you're responsible for knowing what the policy is in your facility. So for example, if you had a medication that was to be given at 1400, in some facilities, giving it at 1330 to 1430 would be acceptable. In other facilities, giving it from 1300 to 1500 would be acceptable. Taking medication at the wrong time of the day or taking medications too close together or too far apart, again, can interfere or take away from the effectiveness of those medications. So it's important to try and stick as close as we can to the ideal times that medication was prescribed. Medications that need to be taken on an empty stomach need to be taken 1 hour prior to eating or 2 hours after a meal in order to meet that time consideration of an empty stomach. Some medications need to be timed with food or milk, and they're often done this way to reduce the irritation on the stomach lining or to promote the absorption of that medication quicker into the bloodstream. As the stomach is busy digesting food, the medication just gets mixed up in that and also gets absorbed a lot quicker. Some of our medications will have warning labels on them talking to different times. So it might be recommended that at this time while on this medication, the person avoids alcohol or tobacco products. It might be indicated what the best time to take this medication is at HS, at bedtime. It might be that, this medication causes drowsiness. So the label warnings might say this is not the best time to be working with heavy equipment and those types of things. So always pay attention to the little labels that are on the bottle along with the prescription label. They add valuable information into how best to get this medication into that body so that it can work at its most effective level. Our sixth right is the right day. Not all medications are taken daily. There's some medications that are taken every other day. There's some medications that are taken for a week at a time, and then they're not taken for a week or two. So it's imperative that we pay attention to the right day. Is this a Monday, a Tuesday, or a Wednesday? When we grab that blister pack, we want to make sure that we're punching not only their morning medications out if it's morning time, but the morning medications for whatever day of the week it is. And the same holds true with their dosette. We want to make sure that we're pulling medications from the appropriate day slot in the dosette. Do not assume that it doesn't matter because all of the days are the same. This could be very, very wrong, and we want to make sure that we're giving Monday's pills on Monday, Tuesday's pills on Tuesday, etc. The seventh R is the right reason. Medications are prescribed for a particular reason, and we will find clients who take medications for alternative reasons. So the example they give you here is your client might report that they took an extra pain pill because they find that it helps them become sleepy and it got them a better night's sleep. We need to counsel this client with respect to that is not the reason for the pain medications. We need to be calling the supervisor and saying this client maybe needs some medication adjustments, or they need some education with their medication. If a client reports taking a medication for an alternate reason, it's our job more than anything to just alert that supervisor so that they can come and do some education and do some digging to see what's going on. It's like clients who want to take an antibiotic for a viral infection. You and I know that antibiotic is not going to be effective to fight that viral infection. In fact, it can lend to more harm than good in the long run as that antibiotic knocks out some of the normal body flora that are helping them fight that viral infection. So make sure your clients understand the reason for taking their medications. Listen and pay attention to them when they're telling you that they may be taking medications at alternate times or for different reasons, and please pass that information on to your supervisor. The eighth right is the right expiry date. Just like food items, just like other chemical products, medications do have an expiration date, and they should never be taken beyond their expiration date. The expiry date of medication indicates, once it's gone past that medication could have changed chemically. And some of those chemical changes can lend to that medication now becoming toxic for the individual, or the medication loses its strength or its potency, or the medication gains in its strength and its potency. The medication is not safe once the expiry date has been reached, and medications who are past their expiry date need to be discarded appropriately. If you're not sure, if the client is unwilling, please notify the supervisor, pass that information on. It might just be that client needs some education from the nurse or the pharmacist or the doctor, but do not assist in giving medication that has gone beyond its expiration dates. Ninth right is the right documentation. Documentation is something that needs to be done, and it indicates that we have completed the task at hand. So documentation is always done after the fact. It's our final step. In healthcare, if we don't document, the task is considered not to have been done. So all medication that's been assisted with or been given needs to be documented properly. Most agencies and facilities use something called the MAR, or Medication Administration Record. And this is a sheet that lists the client's medications on it, the times that those medications should be given, any special instructions for those medications. After the medication has been administered, the client has gotten that medication into their body, you, the nurse, or the client needs to initial or sign the MAR to indicate that that task has been completed for this day at this time. If a client refuses to take a medication, that too needs to be documented on the MAR, because that indicates that we attempted to do the task, we've completed the task. It isn't maybe the results that we were hoping for, but we did address that task and it didn't happen this time. That's valuable information for supervisors and care aides that are coming behind you to know that Mr. Smith refused his Tylenol at this time. Might give us good indication as to why he's in extreme pain when we come along a couple of hours down the road. So again, remember, follow your agency policy and procedure with respect to documentation. It is a crucial step. It's the last step, and it's unfortunately one that gets missed sometimes, but it's imperative that we have that follow through and follow up, and we have that documentation that says this task has been completed. Right, new to a number of the rights that I've looked at over the years, but the right to education. And it's important, and as it should be. Clients do have the right to know why they're taking medication, what they can expect from this medication in the form of desired effect or side effect or adverse effect. They need to have the education to be aware of how to take that medication appropriately and properly and safely. Well, it is the nurse, the doctor, or the pharmacist who generally does the education for the client when they start on their medication. It is still the HCA's responsibility to be aware that this person might need further education and to contact a supervisor if that client is in need of education. Medication, once it gets into the body, it's really hard to get out of the body. So by doing the right, we take steps to prevent those medication errors. So the 10 R's. The 10 R's need to be checked prior to any assisting with medication administration. So each and every time you assist someone with their medications, the 10 R's should be assessed. It is always easier to prevent medication errors than it is to correct them. And the 10 R's are in place to give us checkpoints along the way to stopping medication administration in the hopes of preventing medication errors. The 10 R's, you need to learn them, you need to live by them, and they need to be part of your checking system each and every time you assist someone with medication administration. Medication administration is serious business, and we want to make sure that our clients are safe, and as a result, we will help them with their medications in the safest way possible. And that's by checking our 10 R's every time assistance is given with medications.